Hey everybody, Dr. Perkins here, a board-certified OBGYN, and in today's video, we're talking about, can a woman have preeclampsia after giving birth? You should watch this because you'll learn the signs and symptoms of preeclampsia, what is eclampsia, and the likelihood of getting preeclampsia after giving birth. So what is preeclampsia? Well, I've talked about this in-depthly in this video here on what is preeclampsia. So if you have that question and you want to know the baseline information about what it is, how to get it diagnosed, and treatment options depending on what level of preeclampsia you have, please check out that video linked right here. Preeclampsia, pregnant, or postpartum really presents in a very similar way. If you have symptoms, you may have a headache that doesn't go away with treatment, that's using Tylenol treatment while pregnant, or using any type of pain medication outside of pregnancy and postpartum, such as Motrin or Tylenol, or even stronger meds like narcotics like Percocet or oxycodone. Regardless of what you're being treated with, headaches should overall improve. That, in addition to having problems with your vision or pains in your upper right part of your chest, right below your breast, may be a sign of preeclampsia. And that's the same in pregnancy or postpartum. There are so many patients who would come to me and say, hey, Dr. P, I am not pregnant. Is it possible for me to still have preeclampsia? And the answer is yes. But this question usually comes from thinking about preeclampsia as being pre-delivery. And preeclampsia is not in relationship to delivered or not. It really is a marker to say that you're having symptoms in the presence of having high blood pressure and you are not having seizures or strokes. Because having seizures in pregnancy in the presence of high blood pressure is eclampsia. And so the pre in the term preeclampsia means the time frame that exists before seizures and strokes. And so having eclampsia is very rare because we're aware of the symptoms. We monitor your blood pressures quite well. And in the face of you getting prenatal care as you should, we're able to detect this type of condition pretty earlier on and intervene before you get to eclampsia. Now, for those who do develop eclampsia, this can really cause permanent organ damage internally. If you can think of what the symptoms of a stroke may be, you may lose your motor abilities, meaning that your ability to physically hold things, to move your limbs, to be able to control your tongue, your face, your breathing, your ears, like just everything. And so having strokes is just not something that we would want in a young and healthy person such as yourself or someone that you know. Now, let's dive into developing preeclampsia after birth. You may know the answer to this as I've hinted to it throughout this video, but yes, you can absolutely develop preeclampsia after giving birth because the effects of the placenta on the inside of your body and uterus may still linger even though the physical placenta might not be there anymore. While the physical placenta might not be internal anymore because you've delivered your baby, microscopically, there are cells that came from the placenta that may still be inside of your uterus that during the entire postpartum course where you're having bleeding, that's happening for many weeks after you give birth, a part of that bleeding helps to clear, remove any residual cells that may be inside the uterus and that may also be linked with preeclampsia. And so the placenta might not be there, but microscopically, very small cells and the effects of the placenta being inside for 9 months may be impacting your system. And so you may still develop preeclampsia. It's also important to note that if you can have preeclampsia after you've given birth, that you can also have eclampsia after giving birth as well. So after you've delivered and you've now been discharged from the hospital, you're at home recovering in the postpartum period, it is still very important that you have your vitals checked, whether it be by a home nurse or by following up in the doctor's office to have your postpartum visits done. Again, the goal is to treat preeclampsia as soon as we know that it's the problem. And so if you are not necessarily having symptoms, which is a majority of people with preeclampsia, you will not know that your blood pressures are high or that this condition is going on without actually getting your vitals done. So very important, even after you deliver your baby, please follow up with your provider so that you at baseline know what your blood pressures are like. The likelihood of developing preeclampsia decreases over time postpartum. And so the first 7 to 14 days after birth is probably the greatest period where preeclampsia may develop. At any time, as you're going through the postpartum period, it is very important that you still pay attention to your body and to your health. I know it's kind of difficult, right? Because you have a newborn, probably sleep deprived, in addition to not eating well, and you're probably not caring for yourself the way that you normally would. It is still very important that we know what's happening to our bodies and not brush them off due to the fact that you are tired or you're hungry, right? While caring for your baby becomes first place in your life, if you are not well, it is very difficult for you to care for your newborn as well. And so we want you to care for yourself. So take that time, know your vitals, eat, sleep, drink water, and do your best to create a system at home that allows you to do these things and to pay attention to yourself as well. If at any point you have questions about what's happening, don't hesitate to reach your provider. They will be able to do the appropriate testing and they'll be able to guide you regarding whether or not you need to come in for a visit or if there's anything else that might be necessary to evaluate and treat preeclampsia. And if you've been diagnosed with preeclampsia, but you still have symptoms, it's even more important for you to talk to your doctors at that point and not say that this is due to my preeclampsia, because that could be a change or worsening in your condition and you may need more intervention. So if you fall in any of these categories, please, 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 my hope is that you'll reach out to your providers and get the care that you need. If you've experienced preeclampsia or know someone who has, I'd love to know with the comments below. Go ahead and share with us so that we can learn from each other and help and support each other. I also have a free gift for you that I'm excited to share. If you click the link below, you'll receive a free version of my ebook, Hormones Don't Lie. You'll want to check this out so you can understand what happens internally, hormonally, that may impact your life overall. I'm Dr. Perkins, a board-certified OBGYN, and it's my pleasure, as always, to talk about things that affects us as females and as women. Thanks for being here.